Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. My dear colleagues and PGs, we are discussing update on hepatitis E. In the first video, we discussed epidemiology, structure and genome and genotypes of hepatitis E. Today, we shall discuss the clinical course of hepatitis E, that when hepatitis E virus infects a person, what's the possible course and what is the outcome of this infection. So let's see what's the clinical course of hepatitis E. So this is the second video on update on hepatitis E. We discussed in the first video that hepatitis E virus accounts for more than 50% of acute viral hepatitis infections in young adults, with a case fatality of 1 to 2% in regular patients and up to 20% in pregnant women. Then we discussed that all countries in the world have been divided into two, either the highly endemic, where the endemicity is more than 25%, and endemic, where it is less than 25%, and non-endemic, when the data is not available or it is almost rare. We did know that according to WHO, every year 20 million cases, they are affected by the hepatitis E. Out of these 3.3 million cases, they are symptomatic, and 70,000 of these symptomatic acute hepatitis E patients, they die. We discussed that the Khuroo was the person who first identified hepatitis E virus in 1978-79, and then the Russian army doctor provided the evidence of hepatitis E in a soldier's stool. And it was in 1980 when the viral genome was cloned and named. We also discussed that according to the structure, it may be either naked hepatitis E virion in the stool, or it may be quasi-enveloped or enveloped in the blood of the infected person. We also discussed that there are three open reading frames. The open reading frame 1, which encodes for the non-structured proteins, open reading frame 2, which encodes for the capsid proteins, and open reading 3, which encodes for the regulatory proteins. And then we discussed that the hepatitis E virus, it belongs to the Hepviridae family. There are two genera, so orthohepgeneri, which has got 4 species, and it belongs to the species A, and it has got the 8 genotypes. And then we briefly discussed and compared the genotype 1, 2, 3, 4, 7, 8 according to the area and the source of infections and how does it cause. Today we will discuss some detail about the genotype 1 and 2 and 3 and 4. We will compare them. The genotype 1 and 2, in the distribution wise, genotype 1 is found in Asia and parts of the Africa, while genotype 2 is found mostly in the Mexico and parts of the Africa. According to the severity, more than 16% of hepatitis E virus genotype 1 or 2 infections, they result in the clinical apparent hepatitis. But I was telling that not all patients are symptomatic. So if it is genotype 1 and 2, almost 16% of these, they present as acute, clinically acute hepatitis E. Pregnant women are at the risk for development of acute liver failure, and almost 20% of these patients, these pregnant ladies of hepatitis E, they may die. Risk groups for chronic HIV infections. For genotype 1 and 2, there is no chronic hepatitis E caused by genotype 1 or 2. Till now, no report has been reported. And coming to the endemicity, the outbreaks during conditions of the decreased hygienic conditions, the outbreaks have been reported, and it is feared as well that because of the current rains and floods, there may be outbreaks of acute hepatitis C in the Pakistan as well. When we come to the genotype 3 and 4, as compared to the genotype 1 and 2, Genotype 3 is mostly found in the USA, South America, Europe, and sometimes in the Asia. And genotype 4 is found in Asia and very rarely in the Europe. According to the severity, the genotype 4 infections eventually it's less severe than genotype 3 infections. Out of genotype 3 and 4, genotype 3 is more severe than genotype 4, and less than 2% of hepatitis E virus infections in industrialized nations leads to clinical apparent acute hepatitis E. What we saw that in genotype 1 and 2, almost 16% of them, they present as acute hepatitis E clinically, while in case of genotype 3 and 4, less than 2% they present as acute hepatitis E. Risk group for acute or acute and chronic liver failure in genotype 1 and 2, these were the pregnant ladies. For genotype 3 and 4, these are the elderly men and patients with underlying liver disease. For example, if a patient has got the chronic liver disease because of the fat, alcoholic liver disease, non-alcoholic liver disease, hepatitis B or C, and they are infected with genotype 3 and 4, then they can go for acute or acute and chronic liver failure. Coming to the risk group for chronic hepatitis E infections, in genotype 3 and 4, they can cause chronic hepatitis E. In genotype 1 and 2, no case of chronic hepatitis E has been reported. It has been with genotype 3 and 4, which can cause chronic hepatitis E in immunosuppressed individuals. And what are those immunosuppressed individuals? These are the transplant patient recipients. These are the HIV infected patients. These are the patients with hereditary or acquired immunological distributions, and of course, hematological patients. Coming to the endemicity, sporadic, the genotype 1 and 2, these were endemic, and outbreaks were there during the decreased hygienic conditions, while the genotype 3 and 4, they are sporadic. They haven't reported any endemicity. And rare symptomatic cases has been found, but diagnosed with emerging frequency within the last years. In the last couple of years, the more and more cases of genotype 3 and 4 are being reported. So this is the comparison of genotype 1 and 2 with genotype 3 and 4. So clinically, we can divide these into two groups, genotype 1 and 2 on one hand, genotype 3 and 4 on the other hand. Coming to the age groups, the blue line, this is the genotype 1. And when we see that the mostly this is the age, most age group is between the 20 and 29. So the high number of patients are the more age affected is the genotype 1 is the 20 to 29 years. And for genotype 1 and 2 combined, that the lines showing the red, again, this is the 20 and 29 years. That means the younger age. But when we come to the genotype 3, this is mostly at the later age. So when we compare again here, the genotype 1 and 2, they affects mostly the young people, while genotype 3, it affects mostly the elderly people. So this is the genotype distribution. How to diagnose the hepatitis E virus infection? We all know antibodies, they are the main step for the diagnosis. The anti-hepatitis E virus, IgM, it tells the acute infections, and IgG, it tells the past infections. In acute hepatitis E, either clinically evident or not evident, the E and the IgM antibodies will be present at the end, and the middle, when it is in recovering phase, the IgG antibodies are present. But when the infection is over, then the past evidence is shown in terms of the IgG. Another diagnostic tool is of course, the hepatitis E virus RNA PCR, and this is the sure shot or the confirmatory test, especially in immunocompromised patients where you may not get the antibodies positive, or if they are positive, they're positive only for transit time. So this is a time when the PCR can tell you that this patient has got the acute hepatitis E. So especially if a patient's at-risk patients presents with acute liver failure or acute and chronic liver failure, and you suspect that maybe hepatitis E, and the PCR is warranted over there. So in the diagnostic algorithm, we have two antibodies, IgM, IgG. IgM is for acute hepatitis E, and IgG is for the past hepatitis E, and PCR is definitely for the current or active hepatitis E. Coming to the clinical course of hepatitis C virus infection, the median incubation period is 40 days. The median incubation period is 40 days when patient infects and enters the body and the symptoms appear. The majority of patients infected with hepatitis E virus are asymptomatic. So this is another point, that they are asymptomatic. When we compare the clinical features of acute hepatitis E, we can divide them into hepatic and extrahepatic. The hepatic features, it depends upon whether the patient has got normal liver or the patient has got a chronic liver disease. We divide the liver into four main categories: the normal liver, then the fibrotic liver, and then the cirrhotic liver. I already explained this, what is the normal liver, what is the fibrotic liver, and what is the cirrhotic liver in my study video in the on the cirrhosis. So the clinical course depends upon whether the patient is presenting with hepatic symptoms or extrahepatic symptoms, and hepatic course is depending upon whether the patient has got normal liver or the chronic liver disease. If a patient has got normal liver, then it depends upon whether your patient is immunocompetent or immunosuppressed, because the course is different in the immunocompetent and immunosuppressed individuals. First, take the immunocompetent individual. If a patient has got normal liver and he or she is immunocompetent, so in most of these cases, the acute hepatitis, it goes unnoticed and the patient recovers. But in some of these patients, it may present as acute hepatitis. And I told you that in genotype 1 and 2, almost 16% of these patients, they present as acute hepatitis. In genotype 3 and 4, they present, only 2% of them, they present as acute hepatitis. And most of these patients, they recover. If they have presented in acute liver failure, especially in pregnant ladies, where the disease presents with acute liver failure, so 70 to 80% may recover, but 20% of them, of these ladies, they can die. So the death is associated with the acute liver failure because of acute hepatitis E in immunocompetent patients with already normal liver. Now, coming to the other end, when the patient liver is normal, but the patient is immunosuppressed, what's the clinical course here? Again, most of these patients, they remain asymptomatic, but good number of them, they develop acute hepatitis, and again, it can go to recovery. But if the patient is immunosuppressed and infected with genotype 3 or 4, then this is the group where the acute hepatitis can change into chronic hepatitis. And the chronic hepatitis, again, it can recover, but the antiviral treatment is required over here. But good number of them, they rapidly progress into liver cirrhosis and its sequelae. So in immunosuppressed patients, it may be asymptomatic or acute hepatitis, which may recover, but in genotype 3 and 4, it can lead to chronic hepatitis, where recovery is possible with antiviral treatment, or the patients may develop liver cirrhosis. Now, coming to if a patient has got a chronic liver disease, and that chronic liver disease has been affected by the hepatitis E, what's happened? Most of these patients, they can present as acute on chronic liver failure. So this is the difference between normal liver and chronic liver, that in chronic liver disease, ACLF is the possibility, is the course, while in normal liver, depending upon immunocompetency, whether it is immunocompetent, immunosuppressed, patient can go to one of these groups. Coming to the extrahepatic manifestation, these patients may have hepatic symptoms along with extrahepatic. They may have only extrahepatic symptoms. What are those extrahepatic symptoms? Of course, it may be neurological symptoms, hematological symptoms, acute pancreatitis even, and the renal failure and others. So I'll stop here. Just advising that the hepatitis E virus infections, the clinical course, they may be hepatic course and extrahepatic course. And hepatic course, depending upon the liver, whether the liver is normal or chronic liver disease. If it's chronic liver disease, most of these patients, they can develop acute and chronic liver failure, while in normal liver, depending upon the patient is immunocompetent or immunosuppressed, The course may be different. Like an immunocompetent, the patient may go into may remain asymptomatic, may develop acute hepatitis with recovery, or acute liver failure with death, or even recovery. While in immunosuppressed patients, most of these patients, they remain asymptomatic, but acute hepatitis may happen there and with recovery. And if it is genotype 3 and 4, then chronic hepatitis has been reported. They progress to chronic hepatitis, but they can recover with antiviral treatment, or they can proceed to liver cirrhosis. So I stop here. In the next videos, we will take those I have highlighted in red, like acute hepatitis, acute liver failure in immunocompetent, then acute hepatitis, chronic liver failure, and liver cirrhosis in immunosuppressed patients. I'll discuss these groups in detail in the coming videos. Till then, thank you. Khuda Hafiz. Take care of yourself.